Dr. Ferguson, what is gestational diabetes?
Gestational diabetes is diabetes that occurs during pregnancy. It's essentially looking at your body's ability to regulate blood sugar under stress.
The stress of being pregnant.
So when you're pregnant, your body is under increased stress. Your ability to regulate blood sugar can be impaired. And interestingly enough, looking at your body under stress when you're pregnant can be a snapshot of what your body will do later on in aging. So similar to stress, aging on the body. So women who have gestational diabetes are at increased risk for developing type 2 diabetes later in life as well. So it can be a little warning signal for women as well.
Does it go away after the pregnancy?
Generally, yeah. Generally, it clears with the end of the pregnancy. But again, it's a warning for you later in life that you could be at risk for diabetes. It is some of the well-known risk factors are certainly diet and lifestyle. So that high glycemic index diet, simple sugars, excess weight are things that will put you at greater risk for developing gestational diabetes.
And you're going to be craving, or often women will crave more sweets when they are pregnant, right?
Yep, so that can be difficult.
And could that be because there's blood sugar irregularities?
So one of the sort of vicious cycles that can occur with diabetes is that there's dysregulation in blood sugar, meaning that your blood sugar goes too high, which spikes your insulin, which plummets your blood sugar, which means that your body needs blood sugar to operate, so you crave the sweets again, which spikes your insulin again and drops. So you have this up and down type of